Joining us right now is emergency medicine physician Dr. Stephanie Widmer with the symptoms that you need to look out for even early on. What are they, doctor?
So colorectal cancer does often develop without any early warning signs, but there are potential symptoms you can watch out for. So persistent abdominal pain, and the key word here is persistent, ongoing cramps, gas, or pain in the abdomen, significant changes in bowel patterns or bowel habits that last more than just a few days, rectal bleeding or blood in the stool, unexplained weight loss, and ongoing fatigue. So feeling weak or persistently tired without any other explanation. If any of these symptoms persist, it's really essential to consult a healthcare provider.
And is there a specific age where our awareness should really be heightened?
So typically age 45 and older, risk does increase with age, but cases have been increasing in younger adults. So anyone with these persistent symptoms, it's really important to discuss any potential symptoms or risk factors with your healthcare provider.
Can you tell us about screening recommendations and what that actually entails?
So screening recommendations typically start at age 45, and there are several screening options. There are different tests available, each with its own advantages. And that's really a conversation between you and your healthcare provider. So you may have specific risk factors that would require you to start screening at an earlier age. And there are different tests. We hear about the colonoscopy, but there are other tests that may be appropriate for you. So having that conversation with your primary care doctor or healthcare provider will really help you figure out when and what type of testing should be done. But typically for regular risk individuals, 45 years of age is when screening should begin.
And if you were speaking to us like you were speaking to your patients, if you're in the room there with them, what are you telling them? What's your final advice?
My final advice, really prevention strategies and decreasing our risk. Now we have modifiable risk factors and non-modifiable risk factors. So there are things we can't control, right? Like our age, family history, and genetics, but things like diet, eating a lot of red and processed meats and a diet that's very low in fiber can increase our risk. So diets that are healthy, high in fiber, are really great to help decrease risk. Physical activity is great. Decreasing smoking, tobacco use, and heavy alcohol use are really things that can help kind of decrease your risk for colorectal cancer.
And I'm sure you would agree, be your own advocate always. If something doesn't feel right, it's time to go check it out. Dr. Widmer, thank you for the time this morning.
Thank you.